Many people believe that regular medical screenings are the key to living a long life, especially after age 70. It's a habit that feels safe. Get your blood work done, have a scan, hear everything looks good, and walk away feeling like you did the right thing. But behind that comfort often lie risks that neither doctors' offices nor clinic brochures talk about. Nowadays, more and more older adults undergo tests that don't bring benefits, but instead lead to a chain of unnecessary procedures, anxiety, and sometimes side effects that can seriously impact quality of life. This isn't speculation, it's something we see every day. Take, for example, a brain MRI. It's often ordered when someone starts forgetting names, loses their train of thought, or feels a bit foggy. In most cases, these are normal changes related to aging, but the scan almost always shows something: small spots, mild shrinkage, or changes in the brain's white matter. These are typical findings for older adults, not signs of disease. Still, patients receive reports with terms like possible age changes, perivascular spaces, or degenerative signs. For someone without medical training, these phrases sound like a diagnosis. Worry and fear set in. Next comes a referral to a neurologist. More tests. Sometimes even a lumbar puncture. And in 9 out of 10 cases, none of this reveals anything new, only more anxiety. A study published in JAMA Neurology found that 87% of brain MRIs in patients over 70 showed no treatable condition. What helps more in these cases are basic cognitive tests done right in the doctor's office. They measure attention, memory, and thinking skills. If changes are found, then we consider ways to help: better sleep, nutrition, physical activity, brain exercises. These lifestyle steps impact cognitive function as much as, if not more than, medications. Another test that seems useful is the bone density scan, known as DEXA. It's simple, painless, and takes just a few minutes, but after 70, these scans almost always show decreased bone density. Why? Because it's normal. Bone loss doesn't necessarily mean disease. Yet, based on these scans, patients are often prescribed medications, usually bisphosphonates. These drugs can slow bone loss but come with side effects: stomach pain, esophagus irritation, and in rare cases, jawbone damage. And what about the benefits? A study in the British Medical Journal showed that these drugs reduced fracture risk in women over 70 by less than 1%. That's not a miracle, it's a statistical blip. What works better? Moderate strength training, daily walking, vitamins D and K2, and a diet rich in calcium from green vegetables, sardines, and almonds. These changes truly strengthen bones, and importantly, without side effects. The third test that often leads to overtreatment is the prostate-specific antigen, PSA, screening. For decades, PSA has been considered the gold standard for early prostate cancer detection. But recent meta-analyses show that in men over 70, PSA levels often rise not because of cancer, but due to benign prostate enlargement, prostatitis, or even after bicycling. Still, even a slight increase triggers a cascade: repeat testing, biopsies, sometimes surgery. Up to 60% of detected tumors are slow-growing and clinically insignificant, posing no threat to life. Once diagnosed, patients can't unknow this. Without fully understanding, many agree to invasive treatments that can affect urinary control and sexual function. A far wiser approach after 70 is not to rush early detection, but to assess each case individually, considering symptoms, overall health, and PSA changes over time. These examples aren't a call to reject medical care. They're a reminder: not every test is equally helpful at every age. After 70, the main goal is not to hunt for problems that aren't there, but to maintain activity, clarity, and energy. The best investments are in movement, nutrition, sleep, social connections, and regular care with doctors who see the person, not just numbers. Because health at this age isn't just about a diagnosis. It's about how you feel, how you live, and how you don't let fear, triggered by bad test results, take away what really matters. Unfortunately, many older adults are often advised to undergo procedures that aren't always necessary and can sometimes do more harm than good. I want to share one such example, colonoscopy, and then briefly touch on other common screenings so you can know how to choose what truly benefits you. Meet Mary, a lively 74-year-old woman. She spent her life as a teacher and always took good care of her health. During her last doctor's visit, her daughter's doctor insisted on a colonoscopy, calling it an important screening for seniors. Mary agreed, even though she had no symptoms, pain, or digestive changes. The procedure, however, led to complications. After the colonoscopy, she experienced severe pain, weakness, and an irregular heartbeat. At the hospital, she was diagnosed with a bowel perforation, a serious, life-threatening condition that required intensive treatment and a long recovery. Why did this happen? First, preparing for a colonoscopy isn't harmless. The strong laxatives used can cause dehydration, which is risky for kidneys and heart, especially in older adults. Second, the procedure itself, inserting a camera through the colon, carries higher risks after age 70, including bleeding, tears, and heart rhythm problems. Most importantly, if you don't have specific symptoms or warning signs, repeating colonoscopies more often than necessary can be dangerous. Research, including a large study of over 1 million patients aged 70 and older, showed that for every 1,000 colonoscopies done in people over 75, only a couple of lives were saved. But more than 20 experienced serious complications. This risk-benefit imbalance is significant. It's prompting doctors to rethink traditional screening approaches. Instead, for healthy seniors without symptoms, there are gentler, safer ways to detect problems, like the FIT test for hidden blood in the stool, which you can do at home. It requires no preparation, no sedation, and carries no risk of dehydration or complications. Yet, it catches most concerning cases. Now let's talk about the heart, another frequent topic in our consultations. Cardiac stress tests, where your heart is monitored while you walk on a treadmill or take medicine that mimics exercise, are often given to older patients complaining of fatigue or chest tightness. Sounds reasonable, right? But if you don't have clear symptoms like chest pain during activity, shortness of breath, or a significant drop in stamina, this test can actually cause more harm than good. Accuracy of stress tests decreases with age. Up to 40% of results are false positives. That means the test says there's a problem when there isn't one. From there, you might end up getting an angiogram, an invasive test where a catheter is inserted into your heart vessels, which carries risks of bleeding, kidney damage, and even stroke. Sometimes stents are placed or bypass surgery is recommended, even though there's no clear evidence these improve your quality or length of life. A case from my practice: Raymond, 75, a retired mailman who walked every day. He mentioned feeling tired on hills, so his doctor ordered a stress test. The results were unclear, so he had an angiogram. They found a mild artery narrowing and placed a stent. The next day, Raymond developed kidney problems from the contrast dye used during the procedure. He spent nearly a week in the hospital and took weeks to recover. His fatigue never changed. It wasn't heart, but rather typical for his age, requiring better hydration and rest. Often, a simple resting EKG, where the heart's rhythm is recorded while you're still, or a coronary calcium scan, a low-radiation imaging test that shows plaque buildup, is a safer choice. These tests don't cause complications and don't lead to unnecessary interventions. There are other tests often recommended to seniors without good reason, like brain MRIs, hormone panels, or vision and hearing checks. Of course, if you have symptoms, these are important. But if you're feeling fine, don't feel pressured to do every test out there. Your life and health are your right and responsibility. Our goal is to find a balance between prevention and safety. Listen to your body, discuss every procedure with your doctor, and ask why it's needed specifically for you. Don't be afraid to say no to anything that might harm you. Taking care of your health isn't a race to check boxes and screens. It's learning to listen to yourself and live fully. Today, many people see full-body CT scans as a universal way to catch diseases early and thus save their lives. But the truth is, this method is not a harmless, preventive measure. On the contrary, it carries serious risks that no one talks about. These scans expose your body to a huge dose of ionizing radiation, many times higher than a regular X-ray. In one session, you receive as much radiation as hundreds of chest X-rays. These are not just numbers. This is a potential blow to your health, especially if you are healthy and have no symptoms. Let me share the story of James, a former construction worker who had always been in good shape. He decided to get a full-body CT scan just in case at a private clinic. The report showed a small 4-millimeter nodule in his lung. It seemed insignificant, but it triggered a chain of diagnostic procedures, a PET scan followed by a biopsy. Unfortunately, the biopsy caused a lung collapse, requiring hospitalization and a lengthy recovery. And all this happened because of a benign, incidental finding that could have safely been left alone. Such outcomes are not rare. Images often reveal age changes, cysts, calcifications, nodules. But is it worth searching for problems where none exist? Often, the answer is no. Modern research confirms that excessive use of CT scans not only fails to save lives, but may also cause new illnesses. According to recent medical journal data, up to 5% of new cancer cases in the U.S. may be linked to radiation exposure from frequent CT scans. This risk is comparable to that posed by alcohol consumption. The American College of Radiology clearly states, full-body CT scanning should never be used as a screening tool for healthy people without symptoms. Exceptions are cases with clear complaints, unexplained weight loss, coughing up blood, or noticeable changes in the body. In those cases, targeted imaging makes sense, not a shot-in-the-dark scanning of the whole body. Tests without clear indications are like searching for a needle in a haystack, which can lead to unnecessary, risky procedures and stress. Doctors and patients must understand, prevention does not mean exhausting yourself with tests. It means carefully listening to your body and doing only what is truly necessary. Keep regular checkups with your doctor, pay attention to symptoms, and if a test is recommended, ask why exactly it's needed. Your health is your most valuable asset. Don't let fear push you into procedures that can harm you. Wise choices and attentive self-care, that is real prevention that extends life and preserves quality.